Urethra looks clean.
No lesions, no stones so far. How do we check for obstructions or stones further up?
Contrast cystogram.
Since you found this patient, how about you do the honors?
You know, this guy used to weigh 370 pounds.
Thread the catheter further into the bladder. That's a big drop. Good for him.
He did have gastric bypass.
That makes it less impressive. Now infuse the contrast.
Well, yeah, it is the easy way compared to just diet and exercise.
The contrast dye is dissipating.
It's supposed to. You said he's training for a race. Obviously, he turned his life around.
Still dissipating.
Bypass made it physically impossible for him to eat as much as he wanted.
It's gone. The contrast is gone.
That makes no sense.
Where did it go?
He probably has a fistula, a tunnel connecting his bladder to his intestine.
Air and bacteria moving the other direction caused bubbles in his urine.
Her liver and thyroid are normal, but her electrolytes are off. Her albumin is at 2.1. She's severely malnourished.
She'll be totally vulnerable to post-op infections.
She needs a surgery to survive, but she may be too sick to survive the surgery.
In order to operate safely, we need to boost your caloric intake, optimize protein.
Can't you do that through my IV?
It's more efficient to pump a nutritional supplement directly into your stomach. We use a tube running down from your nose.
I had an NG tube once.
It didn't work. She couldn't tolerate it.
Because it's not really about food. It's about control. You've lived for decades with a condition that has killed more people than any other psychiatric illness. You didn't just survive, you had a child. Can you tell us how?
When I got pregnant, it was like this terrifying miracle. I mean, the thought of gaining all that weight, but I wanted him so much. We both did. Every meal, I would sit with pictures of his ultrasound, imagining the food going directly to him.
Can you do that again? Eat for Graham?
We've determined the fistula between your bladder and intestine was caused by Crohn's disease, an inflammatory intestinal condition.
Once we reverse your gastric bypass, you'll need...
Wait, reverse my bypass? Are you sure?
Well, bypass surgery shortens the digestive tract. People with Crohn's disease need every inch of intestine they have, or they risk critical, even fatal malnutrition.
Okay, but I don't want my husband to know. And he'll be here soon.
Well, we would never reveal anything without your permission, but Crohn's disease is going to require some major adjustments.
Well, I'll tell Spence about the Crohn's, and I'll tell him I'm having surgery on my bladder.
Your husband doesn't know you had gastric bypass?
That would require him knowing I was obese to begin with. That's not going to happen.
Your husband must be very shallow.
Even if I don't disclose that I reversed your bypass, your scars might. It requires a separate incision.
Well, tell him there was a complication.
Our obligation to protect your privacy doesn't include lying. And you shouldn't have to go through this without
The
him.
single abdominal umbilical port. We can repair Wade's fistula and reverse his bypass all through a single incision. We can help deceive your husband.
Honey, I'm so sorry.
That's okay, Spence.
Got here as soon as I could.
It's all right.
And since my husband is surrounded by surgeons, what's the issue? What are you going to do about it? And how often have you done it successfully?
How are you doing?
I'm fine.
Graham, would you mind filling this? You've had 1 spoonful of tuna, 2 ounces of applesauce.
That's it? If that's all I had, you'd never let me up from the table.
This is different. I can't eat too quickly.
I don't believe you.
It's true. Your mother's suffering from severe malnutrition, and she's trying her best.
I knew it. You're too skinny. That's why you're here. That's probably why your heart's messed up and you still won't eat.
Graham, I am trying.
How hard can it be to eat?
I'm not feeling well.
Me and Dad are really worried about you. Don't you care?
Of course I do, Graham. So much.
Then do something. Prove it. You provoked that argument?
Yep, and I may have just saved our patient. She requested an NG tube. Understanding is nice. Calories are better.
He's screwing this up. His husband's scared and he just wants to know what's going on.
Nothing like marital advice from the divorce.
You're divorced too.
And I'm not advising. I'm not judging the health of a marriage based on a single secret, which is neither shocking nor a sign of its imminent demise.
Well, truth in a marriage is overrated.
It wasn't mine. Not every single insight, opinion, or impulse needs to be shared.
Marriage sounds confusing. No wonder you both failed at it.
How's it going in here?
Not as bad as I remember.
Does it hurt, Mom?
No, just a little awkward. Makes it hard to talk. But I'm okay.
I am so proud of you.
Dr. Glassman hasn't defecated or done his physical therapy.
I am aware, and yet unalarmed. Who are you?
I'm Dr. Shaun Murphy.
Oh, right. You're Dr. Glassman's friend.
Please order him to do physical therapy and give him 15 milligrams of X-Lax.
The X-Lax is a decent idea. As for the physical therapy, of course, he's stalling. Glassman's a proud man. He ran this hospital. He's reluctant to feel weak and vulnerable in front of people who used to work for him.
That doesn't make sense. He is weak. He just had brain surgery.
Well, sensical or not, that's my take. He'll walk eventually.
Every day in the hospital increases his risk of infection by 1.37.
Well, you tell him that, and maybe I'll hop right out of bed.
I did. It didn't work.
He didn't respond to the stick. Try the carrot. Although really, I would just advise.
Dr. Glassman doesn't like carrots. What should I do with the stick?
It's a metaphor. Glassman appropriately is the donkey. The stick signifies punishment. The carrot signifies reward, but he's recovering nicely, and your best bet is to just be patient with him.
So I should use a reward to motivate Dr. Glassman to do physical therapy.
Actually, what I'm saying is that you should be patient and supportive. And please, please answer that. Close the door.
We were headed to pre-op when he started projectile vomiting.
It's green. That could mean bile and a partial bowel obstruction. We need an NG tube.
An obstruction? Did the Crohn's cause that?
It's hard to know for sure. NG tube stat.
You're doing great. You should try and get some sleep.
I can't. There's this voice in my head and it won't be quiet. It keeps telling me that this bag has 60 grams of protein, 40 grams of fat, 1,200 calories in total. It just won't stop.
Try to think of Graham and Sam.
I'm trying.
I'll get something to put over that. No! No! No!
I'm sorry. I can't stand it.
back.
Why?
Shaun, I told you that you and I can't live together.
No. You told me we can't be boyfriend and girlfriend. We can still be friends with benefits. The benefit is we would be living together.
I was clear. It's too complicated.
You were. We can't date or kiss or have sex. But I thought you wanted to be friends
Yes, of course.
and spend time together.
Right.
Then it's simple.